I want to give you some details about your upcoming surgery. It'll be at an outpatient surgery facility. We'll have you arrive about an hour before the surgery, and then you'll stay about an hour after the surgery in recovery and then be able to go home after that. We'll want you to have an adult, trusted friend or family member that can take you home, and we typically recommend that somebody stay with you for about 24 hours after the surgery in case you need any help or have any problems as the anesthesia is coming out of your system. We will use dissolvable sutures to close up your incisions. We'll typically cover those up with some small bandages called steri strips. Those steri strips will peel off on their own about 2 weeks after the surgery. Try and leave them on until then. If they do start to peel up a little bit, you can trim off the edges, but try and leave those on for about 2 weeks to protect that incision. Some longer incisions will have some tails of the suture sticking out the ends. We'll trim those off when you come in for your follow-up, but try and leave those in place until then if you can. You'll have a dressing on your surgical site for about 2 days after surgery. Try and leave it on for 48 hours after surgery. At that point, you can actually take the dressing off and shower. You can let water run over the surgery site. We don't want you to submerge it for a couple of weeks, up to 4 weeks after surgery until the incisions are fully healed. But it's actually okay to shower 2 days after surgery and just let water run over it and pat it dry carefully. We'll have you start physical therapy about 1 week after surgery. We'll give you a prescription today, and we encourage you to start contacting them immediately to set something up for a week after surgery. If you wait until after surgery to set it up, sometimes the therapy office is booked out for a couple of weeks and it's hard to squeeze you in. So if you start working on that right away, it'll be a lot easier to get an appointment in a timely manner. We found that the patients that start their physical therapy about a week after surgery have a little quicker recovery and overall tend to do a little bit better after surgery. We'll have you not eat or drink anything for about 10 hours before the surgery. That includes water, coffee, milk. We don't want you to eat or drink anything. You need to come with an empty stomach. That'll make the anesthesia a lot safer. Now, if you need to take any medications the morning of surgery, you can do that with just sips of water. Don't drink milk or coffee once again, just some sips of water to get that medicine down. We'll go over your medications with you today. If you have any questions about what medicine you need to take the morning of surgery, we'll make sure we go over that with you today. As a general rule, we usually have you take any blood pressure medicine, thyroid medicine, or antidepressants with some sips of water the morning of surgery. Any medicines that you take at night, you can take those the night before surgery without any issues. We'll also go over any blood thinners that you're taking, and sometimes we'll have you stop blood thinners before surgery as well, but make sure we go over that with you today before you leave. I want to go over a few of the risks of surgery. Some of the most common risks that we worry about are infection, nerve damage, stiffness, re-tearing, anesthesia complications, and blood clots. Now, fortunately, those are all rare, but they do occasionally happen. We'll do our best to prevent all of those, but it still does happen on occasion, and we'll do our best if any of those do happen, we'll do our best to take care of you and try and minimize any effects of those. Even if the surgery goes well, even if you do everything in your power in your recovery, sometimes those things still happen, and we can't promise you there won't be any issues, but we'll do whatever we can to prevent those. We'll prescribe some pain medication for you to take after surgery. I'll send it in today, and then so you can pick it up ahead of time. Don't take it before your surgery, but you can start taking it after the surgery. Try and only take it for a few days after surgery. There's a lot of side effects and a lot of risks to this medicine, and so the less you take it, the better. As soon as your pain is under reasonably good control, we prefer that you switch over to Tylenol, ibuprofen, other over-the-counter medicines that don't have all the side effects of these narcotic pain medicines. One of the main issues we see with the narcotic pain medicine is it slows down your GI tract, and so you can get some bad constipation. So we also recommend you try an over-the-counter stool softener if you're taking narcotic pain medicine to reduce the effects of that constipation. After surgery, I typically like to see you back about 2 weeks after. We'll check on your incisions, we'll check on your range of motion, we'll make sure that things are healing up well and things are going well with therapy. But if you have any problems or any concerns before the 2-week mark, please feel free to call us. We're happy to address those with you. I hope this answers some of the questions that you have. Please let us know if you have any other questions, and we look forward to taking good care of you. I wanted to give you some additional information about your upcoming knee arthroscopy surgery. Most knee scope surgeries take 15 to 20 minutes. You'll be asleep for the surgery, but you'll wake up quickly after. They just use a very light anesthesia to have you sleep for that surgery. We're able to do these surgeries through 2 small incisions, about 1 to 2 centimeters each in the front part of your knee. We'll sew those up with dissolvable sutures and then have some steri strips over those as well. Let me explain a few of the terms we'll use. Partial meniscectomy is what we typically will do in a knee surgery like this, where we just trim out some fraying of the meniscus. We think of it like a hangnail. You have that little broken piece of nail getting caught, causing pain. Just by trimming that off, your pain usually gets a lot better. Same with a meniscal tear. If you have a small torn piece of that meniscus that's causing pain, if we trim that off, that should remove that source of the pain. Limited synovectomy. Sometimes there's some inflamed tissue in the knee that we can trim out and remove that source of pain. Chondroplasty. If you have some fraying of the cartilage, sometimes there's some loose pieces hanging off that we can trim out. That will reduce that source of pain. A meniscus repair. Occasionally a meniscus is torn in an area that has a good blood supply. If it's detached, we're able to reattach it with some sutures. We'll do a meniscal repair, either a medial or lateral meniscal repair, and then that'll have a little bit different recovery. After a knee scope, typically you'll need crutches for 2 or 3 days, but you can start putting your weight on it immediately. Usually within 2 or 3 weeks, you're feeling pretty good, easing back to most of your normal activities again, with the exception of a meniscal repair, which will have a little bit longer recovery, where we have to give that meniscus some time to heal. Most patients are able to return to work within a few days of surgery if it's a lighter demand job, but if it's a heavy demand job where you're on your feet a lot or doing a lot of lifting or carrying, it can be 2 or 3 or 4 weeks till you're feeling good enough to get back into your job. If you have some arthritis in your knee, we won't be able to fix that with the scope. What arthritis means is that your cartilage is wearing thin and you don't have as much cushion in there, and so we don't have a way to fix that arthroscopically. The only surgery that could fix knee arthritis is a knee replacement. Now, if you have some loose pieces of cartilage or some fraying of the cartilage, sometimes we can trim some of that down, but we want to actually be able to fix the arthritis through the scope. And so if you do have arthritis in the knee, you may still have some arthritis type pain after the surgery, even if the surgery goes well. But I hope this answers some of your questions about the surgery. If you have any other questions, please let me know. We want you to have a good experience and hopefully have a quick recovery.